Hello and welcome, dear Dental TV community. Today with a special guest. She's also in a special location. It's Dr. Douaa, originally from Tunisia and now living, she's like a globetrotter, worked in Switzerland, in France and everywhere. A young colleague. And I just found you on social media because somebody was talking about the 3P method. And I was like, what is the 3P method all about? Why is a young dentist talking about, if we take the 3Ps, just to repeat, I prepared myself. Look, the 3Ps are purpose, people, and precision.
Exactly.
So to start the conversation, first, I would like to know who you are and why you started with this project of 3P method. What is this all about?
I would like really to thank you for this invitation. I'm so happy to talk about my 3P method, about myself, about the book too. I'm going to present myself. As you said, my name is Douaa Khnissi. I'm a dentist. I'm a clinical leader today and the creator of the 3P method and the writer of the upcoming Behind the Smile, the upcoming book Behind the Smile. I've worked across many countries, across teams and pressure. And what I saw again and again is that dentistry really needs something more, not just clinical excellence. But here we are talking about clear and confident leadership. I've recently been accepted to Harvard and Cambridge for advanced training in strategy and coaching. And now I'm really dedicating my work for to help dentists transforming their clinics from the inside out. And here where starts the 3P method and the mindset shift. Let me say that.
So basically, are you still working as a dentist, or did you shift completely to the other side, as many would say, to it's not the dark side, but let's say away from, because as a dentist, you have to be not only the doctor treating your patients, you have to be the entrepreneur, you have to run the business, you have to lead your team, you need to know about finance, about marketing, about so many things that we never
Like,
learn at dental school. And that maybe in the past it was different, because when I started, or before I started my dental office, the thing was easy. If you were a dentist, you made money, and it was enough, even if your workflows, especially in your organization of your dental office, were not perfect. So basically, the profit was enough that you were able to make a lot of mistakes without not being successful. And this has changed over the last 20 years completely. So today, if you don't know about marketing, if you don't know about how to lead your team, if you don't know how to save money and make more money, still being a good dentist, you go bankrupt. And that's why I think when we talked the last time, I already mentioned that coaches are popping out like mushrooms
mushrooms, yeah.
from the ground. When I was a young dentist, I didn't know any coaches. So we learned by learning by doing, learning by making errors and learning from our mistakes. So it was a different way of how we approached our profession. We spent 100 hours per week in our dental office.
Absolutely.
And you're representing the younger generation. And it's interesting that in the younger generation, it seems that some, like you, have realized that dentistry is more than just drilling holes, than just filling teeth and doing bleachings and veneers and trying this. It's more. But to answer my questions, how much do you still work as a dentist, and how much time do you dedicate to your new baby, the 3P method?
Exactly. Actually, it's a good question. Why? Because today, if I'm going to talk about management and I'm not managing my life as a dentist, and at the same time, I'm standing in the dark side, it's not going to be possible. But today, I really took a step in this part, let me say, of dentistry, because it exists. And if we are just thinking about it and don't go to the point, it's going to make the mind charged. Like we are always exhausted, we are always over pressure, and we are not resolving the problem. I'm still working as a dentist, but for only 2 days per week. Because for me today, I want to concentrate even more for this field, because really I'm creating the 3P method. Let me say it's just the beginning, because I'm building a full ecosystem around it. As you said, because you said everything, there's nothing to say after you. No, because really, I agree with you. Today, I'm building a full ecosystem around it, and one that offers not only coaching, but also supportive things dentists quietly struggle with today, like communication, branding, digital presence, and team harmony. And everything will stay rooted in the language of dentistry. I'm not going to talk about the statistics with numbers, and just telling these, let me say, these words, these numbers, without having a method that I'm working with. And whether it's a manager I will train or a coach I bring in, they will think like a dentist. This is the project that I'm making, because that's what we are. And if someone is coming talking about just like mm, giving theories like magic, we're not going to believe it.
That's
But
an
no
interesting
one,
that's an interesting point, and we see that in the dental industry,
yeah,
we have less dentists inside the higher positions of the companies.
yeah,
So basically, marketing guys, economy guys, whatever, and they don't know how a dentist mind works. And this is difficult. And I see that the industry is losing the connection to the dental community.
that's true.
And the dental community itself is a very special ecosystem. I had an interesting discussion 2 weeks ago. What is the most challenging point in dentistry? The most challenging point we have to fight against is envy. Dentists are so egoistic and jealous that they don't want that they have their ecosystem, their small space where they live and work, and they hate. I by purpose over overdo it. They hate each other. They would never collaborate, and this is one of the major things why dentistry is not getting further. We are not moving ahead. We still have a bad image in the public view. In any cinema, the dentist is the bad guy. Dentists hurt. Dentists are expensive. There are almost no positive terms. If you ask
Yeah,
anyone on
they're
the
not.
street, if
Yeah,
you
that's
ask
true.
anyone on the street, give me a positive word describing your dentist. And I think they will have a hard time to find. And the number one positive word they should say would be trust.
Yeah.
If you trust somebody, then everything goes much smoother. But let's come back to, why did you choose these three words? Purpose, people, and precision. Because you wanted to find the three P's? Or you could say,
Not at all.
if it's the 3F method, you need to find three words with F. So
Oh,
why purpose first, people second, and precision third? Because for me, it would be people first. So the patient for me is, if we are looking also into evidence-based dentistry, the patient is basically in the center,
yeah.
and we have our knowledge, we have the evidence and what the patient wants to create what we are doing. So why did you put purpose in first position, people in second, and precision in third?
Thank you so much for this question, because really it's really important for my method that we are like we need to put them in this way. Why? Why? The purpose for me is the compass of the dentist, because I see and I saw most dentists lose sight of it. Like under daily pressure and under the stress. For me, without it, everything collapses. The purpose is number one. It's not the people. Attention. But really, it's really important. And I will tell you by the end why. And it's about the purpose. It's about especially knowing why you are in that chair every morning, why you need to go to work, not just to fix things, but you need to know that you are going to lead with intention. You have a team that and patience. And even for people, it's not only patients or your team, it's yourself as a dentist. So it's really important too. But first of all, we start with purpose, with your compass. And for people, as I said, is the patients, the team, and the dentist too. We don't forget about him. And the team is your really engine, your engine. You stop thinking that team is your burden. It becomes your strength when you're going to apply this method. Because with clear rules and rhythms, they move with you, not against you. And this is really important. I saw some dentists, they don't know the strength of their team, the strength what every one of them can give you. And you have to dig for that. And it's not about micromanaging. It's really important too that it's about real leadership. You know what I mean? And to finish with is the precision is your structure. The structure, the systems, the protocols, and smart decisions. This is really important that replace stress and improvisations that I didn't like at all. When I find like sometimes assistants, they are improvising, there are no rules, there are no reference, they find the problem and they try to fix it. No, I'm against that. You stop running your clinic like a gut feeling and start really running it like a real leader, a real business. And I found it really magical in this 3P method. Like the purpose will guide your people, and the people will bring your precision, and at the same time, the precision protects your purpose. So it's like a cycle. We are talking about three pillars. You will not talking about just one. And as I always see that, like you told me, the team is the center, or the people is the patients and team in the center, and all like a tree. No, I'm not making that, because even the method itself, it's adaptable. I'm not going to put it like this for a dentist and goodbye. You can do everything by yourself. No, it's going to change. It's going to change. And even my book today, I'm going to have a first edition, and then it's going to change by time. Because I hate when something is, stable, like a box. We can change it. No, it's this way or not. No, it's not like this at all.
So this brings me to a point that, let's say, a statement that goes not only for dentists. We all are using the doctor's approach. So the doctor's approach is collect information, then diagnose, and then do a treatment or action plan. You can use it also for your coaching. So analyze the situation, find the diagnosis of the problems, what are the issues, and then what are the next steps? What is the treatment plan? What is the action plan? So how are you, or how do you start when I say, I feel exhausted, I don't know what to do, I see that my team is not happy, I'm not happy, I don't like my job anymore. So how do you start? How do you start working with somebody who asks for your service or for your advice, for your coaching?
When I started with 21 days of brainstorming what you have as problems. Like when I started with friends, but colleagues that they are friends, we started with 21 days, like brainstorms. I said to my friends, for example, take your time. Just put me all the problems that you have, and even that you just have 21 days to give me all the problems that you face in this 21 days, or even in that you faced before. And it starts like this because I want the dentist, himself know his problems. I want him to dig in his own clinic. It's like really, like putting the dentist in the right place in his clinic, because sometimes we just forget about it, forget about our real place. So I start always with brainstorming. With even I ask the all the team to write down the problems that they are facing daily.
I think that's an important point that you are mentioning, that you should not only take one person from, let's say, 10 or 20, you should ask all of them, because maybe the one of the assistants has a major issue and that
Yeah.
impacts the whole team. And I think it's important to really find as many points and then again collect the information. And then, so how do you diagnose? So when after the 21 days,
Yeah.
and then you're saying, okay, as far as I understand your method, then you also need to break it down. What problems are in the purpose area? What problems are in the people area? And what problems are in the precision area? So basically, it's
Yeah.
personal issues, team issues, business issues. How do you structure, and what is then the next step?
Actually, then I start to like categorizing them, as you said, and to find solutions, and especially to go to the root. I'm not giving the solution from the outside. I go deeper, and sometimes I even ask more questions, because sometimes the dentist or the assistant gives you a problem, and then you go there, you go to the clinic, and you find that it's not the way they are saying it, or it's like you need to find the real problem. Let me say that the real problem, and I go deeper to solve it.
So basically, you're visiting also the dental office and
Yeah,
playing a little bit the hidden person that is just the small mouse that is watching everything the whole day, and then writing down what you saw,
yeah,
what is working and what not. Because I think this would be from my side better than just doing an online coaching. I think it's important to go there and see in real life
that's
what matters. So basically, honestly, so that's why you're only working 2 days as a dentist. So you have the 3 days to go and see other offices and
exactly.
check out what's not working, or how is your, or how do you sell? Because basically you sell a product, you sell a coaching, you sell a service, and then you need to know, or you need to tell people, okay, we have the preparation, I have a book, I have all the basic information that you can read before we start. And then from there we go and I monitor, I follow you. So how long does it take? So 21 days for the brainstorming, then I would say another few weeks to find out
The,
to diagnose the problem, and then the follow up. How long do you think? I know it's not, it depends on the situation, but in a normal way, how long do you think are you mentoring, monitoring, following dental office after step one and step two?
For now, it takes the maximum, but I just need to talk about something really important. It's not always possible to move to the clinic, because I even had dentists from Brazil, from Texas. They asked me help, so it's not always really possible. But I always try my best to be as close as I can.
Maybe they can walk around with the smartphone and shoot some movies, or what are you doing? Huh? Oh, that if that I take my smartphone and I say, okay, Doa,
Yeah.
and now I'm in my office and I show you around and
Yeah.
look, this is the situation. Say, no, come on, you have to do this different. And
Yeah.
basically, what tools are you using to monitor your clients?
When I can't move to the clinic, I prefer to make reunions. I can't go with him because we know, as always, we always go back to the same point. We need to think as a dentist, and we are dentists, and we know what's happening every day in our clinics. So imagine if is it possible to take a smartphone and go around? It's not possible at all.
No, you can.
So
There are some cool cameras that you can mount on your chest,
yeah,
or you can use like
like a spot.
in the future, you have to go around and use like the Ray-Ban Meta.
Yeah.
And then even nobody knows that you are shooting videos. You know what I mean?
Exactly.
So
I
because
know.
I'm using the glasses also in my office.
Okay.
The only thing that for data regulation in Europe, the Hey Meta does not work.
Doesn't, yeah. Yeah.
Because I would, it says the feature is not available in your region. So basically, this is the problem we have with data safety regulation in Europe. And so
Yeah.
some new technologies cannot be used, although it would be very helpful for also for coaching services like yours.
Yeah.
That you adjust, you put your glasses on and nobody knows or nobody, you, okay, obviously you have to tell your patients or your team that you are shooting a movie,
Yeah.
but I think this is very helpful to show, walk around and show people what you're doing, or yeah,
It's
also
a
for your
good
coaching
idea.
services.
Yeah. For now, I'm like preferring to talk with dentists and the team. Maybe in the future, when I'm going to show how to do it to a manager that doesn't know what's happening in the clinic, maybe it's going to be, yeah, to register a video or something. Why not? Sometimes there is actually I want to talk about the targets, like my where I'm looking, like who is the dentist who needs this method. And sometimes when I post on my Instagram, some dentists send some messages like saying, oh, okay, I'm not burnt out, everything is fine. Well, because actually, and my they don't know that I also created this method for this for those who say I love my job, my clinic is doing fine, I don't need the methods, something like this.
But this is a good point because coaching, mentoring should not start when you are burned out, because then it's in many situations too late. Maybe you're then in a situation that you really say, hey, come on, I quit. I sell my dental office. I go surfing. I do whatever, but I hate my job. So I think it's like in any marriage or a business relation or whatever, you should not wait until it's too late. So basically, I think I highly recommend anybody, even if you think you're a successful dentist, to from time to time. So that's why we are doing team meetings every month
Yeah.
and talk to the team and ask them what's good, what's bad, what can we change. And this is how a successful business runs. So basically, I think people like you should not only try to get the dentists that are almost at the edge of suicide or quitting their job
Yeah.
before a burnout. So
Period.
this was also what the question I asked you. You are a young dentist and you have not experienced this classic situation. I was stressed, I was burned out, and then I stopped. I sold my clinic, and now I am a coach and help others not to get through the same story. So I think you start before all that, and this is from that's why I'm talking to you, because I think this is a clever and smart approach to say, talking about prevention. Prevention is not only the most important thing in medicine and dentistry, that is still we are struggling to really sell. to do more marketing, to promote prevention more, because a lot of people say, yeah, prevention is not getting me money. Why should I tell my patients to brush their teeth and blah, blah, and so on. But prevention also in your business, I think this could be that this is then the fourth P. Plus the
Prevention.
3P method is
I
the
think
4P. It's the 4P method, because prevention, you should add the P for prevention. So prevent to fail, to get burned out and everything should be a point that I would add to your 3P method and make it the 4P method. So this leads me to a question. So you're a young dentist. What is the future of dentistry? So we have a lot of changes. Actually, the major change in the Western world is that dentistry is switching from a male profession to a female profession. There are some countries where for many decades already it was a female profession, but for different reasons. But overall, globally, it becomes more a female profession.
oh gosh.
It's a very interesting transformation. And there are many reasons why it happens. One reason is because the average income is going down,
Yeah.
and a man selects the profession in correlation to the possible income. And
Yeah.
dentistry no longer is a top. It's a good business, but you have to work very hard to make money. And there are many other professions that you have to work, but not physically, mentally that hard as a dentist or a doctor. And so this is switching. And for women, it's still a good profession to work part-time, to earn decent money. So how do you see the future of dentistry, and what is your role in the future of dentistry?
Oh God. Okay. Actually, this is a big question, but I'm before answering it, I'm giving you just two examples or maybe three about because you talked about how to prevent, and actually it's not of the fourth P, it's the biggest P. Really, really, I feel like okay, there is the pillars, and inside it's the prevention, as you said. It's not when I'm going to feel like I need to go to finish everything. Yeah, let me see. Where is the coach I saw in the dental TV? No, it's not like this at all. And I will tell you something. I talked about the first one who knew about my method was a friend of mine. And from the outside, his clinic looked perfect. You know what? What's perfect clinic, like full schedule, loyal patients, solid income. And he was like, behind the scene, he was struggling. You know why? Because everything they were depends. They depend on him in everything, in every decision. And after applying the 3P method with him, he called me. I remember exactly what he said. He told me, Doa, I thought I had a good clinic, but now I have a smart one. And I was like, oh, thank you. I'm going to talk about this every day because really, we didn't rebuild the clinic or did something magical, but we fine tuned it and it changed everything, everything. And I remember another dentist who found me on Instagram and already halfway to burnout. He'd lost his spark. He told me, I want to stop dentistry. And he's in France. I remember he told me, like, I can't do it anymore. I feel overwhelmed. And here we are talking about a dentist who doesn't know that coaching, or maybe we need to start from the first day in the clinic, the first day of being a dentist. We work together to reconnect with his purpose and clean up the system, let me say, and shift the way he led. And not long after, he told me, I finally feel in control again. He told me that. And let me tell you an extra example. Let me say, this is the story. This story is mine. Actually, I remember I walked into a clinic where that had zero structure. I started with 2 patients are in the schedule, and I was told it's all yours. Fix it if you can. Like this. And I remember I was saying to myself, it's a big challenge. I'm going to do what I need to do. And by the end of the 3 months, really 3 months, we had the full schedule, and the team was actually smiling again. And honestly, these stories are what keep me going. The stories are what every time I remember what my friend told me, what the dentist that was about to close told me, and inside of me, why I say to myself, okay, I love dentistry. I love dentistry. Really. It's for me, it's not just a job. But at the same time, we need to stop thinking in an egoist way. I was thinking about all my colleagues at the same time of being a dentist. And it wasn't the first time I'm thinking like this. Because every time I go to a clinic and I work with a dentist, a colleague, every time I feel like it's my clinic, I need to fix the problem. That's why I said to myself, it's for me, it's not just smart to do it or something that I was like living the future. Let me say, no, it's inside of me. I want to do that. And I want to help other colleagues to be there, to be what I have in my mind. It's mindset shift, really. So let me go to the question that you asked me. And really for the future of dentistry, I imagine dentists who lead and not just survive, not just practicing. No, you need to lead, you need to know your purpose, you need to focus on your people, and people, that means you too, patients, team, and yourself, and to really concentrate 1000% on your precision, the system, the how to control all these things.
But basically, we need to change the dental education.
Yeah, thank you. Yeah, exactly. The dental education, it's really concentrated on how to do dentistry. Goodbye. We don't give you, in the university, they don't give you the way how to lead or to be a dentist in a business, because after all, opening a clinic is a business.
So there I see the big chance. And I did some videos. I read some articles about the role of artificial intelligence in the whole game. I see that artificial intelligence will help us to reduce by a large amount all the theoretical courses, because you don't need that anymore. You don't need to learn how a medication works and blah, blah. So hundreds and thousands of hours can be wiped out because we have artificial intelligence. You wear your glasses, and if a patient asks, "Hey doctor, I'm taking Xarelto because I'm for the bleeding. Can you do the extraction?" And you can ask artificial intelligence. Why not? So basically, there are a lot of things that we don't need to learn because things are also changing. What we should focus on in our dental education is to work on our manual skills as much as possible,
Yeah,
and then work on our skills that you are mentioning: how to be a leader, how to run a successful office. And I think this would bring back a lot of fun into our profession. So basically, we had the switch in the 1990s, where when I was a student, we had a lot of practical education. The number of hours on the patient has been reduced dramatically because of this Bologna reform and everything, that we need to be more scientific and blah, blah, and everything. But take this theoretical part, cut it down, add some leadership and managing and things, and blow up a little bit also the practical education. I think dentistry is a wonderful profession.
exactly. But
And yeah,
let me tell you something just in this purpose, because dentistry for me, it's not about working harder, it's about working smarter. That's it, really. And even if in my vision, I want to build a world where leadership in dentistry really be accessible and clear. And even, dare I say, light. Because today, when you're talking about management or leadership, oh, whoa, what are you talking about? It's Chinese. No, it's number one before. And as you said, we need to focus. There is other, okay, the AI is taken a big, we don't need to cry on it. We just need to accept that today we need to focus on other things because otherwise we'll go, a lot of dentists, they're going to be like,
Again,
"Oh,
we can focus on the most crucial part of our profession, that is communication.
yeah,
So if you are my patient and sitting in the chair, you should think after a few minutes, wow, this doctor knows what he's talking about. I feel comfortable. I trust him. And yeah, so this is then the good start. And it makes you as a dentist also feel much better if you feel positive energy and not the patient sitting in the chair feeling stressed, and you feel the anxiety and you feel all the negative energy, and the negative energy flows into your body. So this is there are a lot of things that I experienced over the many years of dental practice,
yeah,
but
I can imagine.
I really enjoy and that a young dentist like you are trying to change something, because it's not about making business or selling a method. I think it's about changing the way we are looking at our profession, the way we are working, the way we are facing problems, everyday problems. So I'm really looking forward to see your book coming
So
out.
the,
I will read. I then want a signed copy, Dua.
the special copy, you'll have it. And then
And for sure, I will follow you. What your 3P or 4P method is all
actually,
about, how successful you are. And for sure, we will talk again. And I already told you, Dental TV is also open. I made the move now from the Vimeo platform back to YouTube to be a little bit more open to the dental community. I had a lot of positive feedback, switching back to, let's say, a public platform.
yeah,
And we will for sure record more videos with you talking about purpose, people, and precision. So thank you very much, Dua, for your time. And I feel your energy, and keep up this energy. This is important. And maybe you have some final words for our people watching and listening to us.
oh, yeah. Thank you so much. I'm really, this 3P method is going to change the future of dentistry. And I believe so much in this method, and this is just the beginning. Okay. So next step is going to be like this weekend. I'm going to give the possibility of all my followers in the Instagram Behind the Smile by Doa. I'm going to give them a PDF for free about the 3P methods. And then everything is going to be, they are going to be updated for the book, for the webinars, for the courses, and for next interviews with you. And I'm so happy really to meet you and to talk today about my book and my 3P methods. Yeah, in the future we're going to make other videos, and yeah, why not? The special copy is going to be for you, but because Ganda Smile is going to be a limited edition.
No,
Uh,
that sounds amazing.
oh yeah,
That's why everybody out there, keep following what Dua is doing, and also on Dental TV, what we are doing. Keep
yeah,
watching, keep learning, keep leveling up your skills. And for me, the final word is keep up being curious like a child, and keep up being passionate about what you're doing, like Dua is. And see you back again soon.
that's for sure. See you.